In the world of anticoagulants, the battle between Xarelto and Warfarin for thrombosis prevention is fierce. Both drugs offer effective methods of thinning the blood, but which one reigns supreme? In this video, we will dive into the duel of these anticoagulants and examine their strengths and weaknesses. Xarelto and Warfarin belong to different generations of anticoagulants, with Xarelto being a direct oral anticoagulant, DOAC, and Warfarin being a vitamin K antagonist. Xarelto is lauded for its convenience, as it requires no regular blood monitoring, while Warfarin necessitates close monitoring due to its narrow therapeutic range. Effectiveness and safety are key considerations when comparing these medications. Xarelto has shown promising results in large clinical trials, demonstrating its non-inferiority to Warfarin in preventing and treating thrombosis. However, it is important to note that Xarelto carries its own set of risks, including the potential for uncontrollable bleeding. To make an informed decision, it is crucial to understand the differences between Xarelto and Warfarin and how they may impact your individual health needs. So, let the duel begin as we examine the pros and cons of these anticoagulants in the ultimate quest for the best treatment option. What is thrombosis and why is it a concern? Thrombosis is a condition characterized by the formation of blood clots within the blood vessels, obstructing normal blood flow. This can lead to serious complications such as heart attack, stroke, or pulmonary embolism. Thrombosis is a major concern due to its potential to cause life-threatening situations and long-term disability. Understanding anticoagulants Xarelto and Warfarin. Xarelto and Warfarin belong to different generations of anticoagulants, with Xarelto being a direct oral anticoagulant, DOAC, and Warfarin being a vitamin K antagonist. Xarelto works by inhibiting a specific clotting factor, while Warfarin interferes with the production of several clotting factors. Both medications help prevent blood clots from forming or growing larger, but they achieve this through different mechanisms. Xarelto is lauded for its convenience, as it requires no regular blood monitoring, while Warfarin necessitates close monitoring due to its narrow therapeutic range. The effectiveness and safety profiles of these anticoagulants play a significant role in determining the most suitable option for each individual. Pros and cons of Xarelto for thrombosis prevention. Xarelto has gained popularity due to its ease of use and lack of regular monitoring requirements. One of the major advantages of Xarelto is its fixed dose regimen, eliminating the need for constant dose adjustments. This convenience factor makes Xarelto an attractive option for patients who prefer a simplified treatment approach. Additionally, Xarelto has demonstrated non-inferiority to Warfarin in large clinical trials, showing its effectiveness in preventing and treating thrombosis. It has been found to be as effective as Warfarin in reducing the risk of stroke and systemic embolism in patients with atrial fibrillation. However, like any medication, Xarelto has its drawbacks. One of the major concerns associated with Xarelto is the potential for uncontrollable bleeding. Unlike Warfarin, which has an antidote, vitamin K, that can reverse its effects in case of bleeding, Xarelto does not have a specific antidote. This can be a significant concern for patients who are at a higher risk of bleeding or those who may need urgent surgical interventions. Pros and cons of Warfarin for thrombosis prevention. Warfarin has been the go-to anticoagulant for several decades and has a long track record of success in preventing thrombosis. One of the key advantages of Warfarin is its ability to be easily monitored and its reversible effects. Regular blood tests, such as the International Normalized Ratio, INR, help healthcare providers adjust the dose to maintain the desired level of anticoagulation. Another benefit of Warfarin is its affordability. Compared to newer anticoagulants like Xarelto, Warfarin is considerably less expensive, making it a more accessible option for patients who may have financial constraints. However, Warfarin has its own set of challenges. The narrow therapeutic range of Warfarin requires careful monitoring and dose adjustments, which can be burdensome for patients. Frequent blood tests and dose changes are necessary to ensure the medication is working effectively and to prevent complications such as bleeding or clotting. Xarelto versus Warfarin, a comparison of effectiveness. When comparing the effectiveness of Xarelto and Warfarin, several factors come into play. Clinical trials have shown that Xarelto is non-inferior to Warfarin in preventing stroke and systemic embolism in patients with atrial fibrillation. Similarly, in the treatment and prevention of deep vein thrombosis, DVT, and pulmonary embolism, PE, Xarelto has demonstrated comparable efficacy to Warfarin. However, it is important to note that individual responses to anticoagulants can vary. Factors such as age, renal function, and concomitant medications can influence the effectiveness of both Xarelto and Warfarin. Close monitoring and regular follow-ups with healthcare providers are essential to ensure optimal therapeutic outcomes. Xarelto versus Warfarin, a comparison of side effects. As with any medication, Xarelto and Warfarin carry a risk of side effects. Xarelto has been associated with a higher incidence of gastrointestinal bleeding compared to Warfarin. Additionally, Xarelto may cause symptoms such as dizziness, headache, or muscle pain. On the other hand, Warfarin's major side effect is the risk of bleeding. Close monitoring of the INR is crucial to avoid bleeding complications, and dose adjustments may be required to maintain a balance between preventing clotting and minimizing the risk of bleeding. Factors to consider when choosing between Xarelto and Warfarin. When deciding between Xarelto and Warfarin for thrombosis prevention, several factors should be taken into consideration. The convenience of Xarelto, with its fixed dose regimen and no regular monitoring, may be appealing to some patients. On the other hand, patients who prefer a more monitored approach or have a higher risk of bleeding may lean towards Warfarin. Individual patient characteristics, such as age, kidney function, and concomitant medications, can also influence the choice of anticoagulant. Consulting with a healthcare provider is crucial to assess the individual's specific needs and determine the most appropriate treatment option. Case studies and patient experiences with Xarelto and Warfarin. To gain a deeper understanding of the experiences of patients taking Xarelto or Warfarin, let's explore a few case studies. Case Study 1. Mr. Smith, a 65-year-old male with atrial fibrillation, was prescribed Xarelto due to its convenience and lack of regular monitoring. He reported no significant side effects and felt confident in his ability to adhere to the fixed dose regimen. Case Study 2. Mrs. Johnson, a 72-year-old female with a history of recurrent DVT, was prescribed Warfarin. She initially struggled with the frequent blood tests and dose adjustments but eventually adapted to the routine. Mrs. Johnson reported feeling reassured by the ability to monitor her INR levels and appreciated the lower cost of Warfarin. These case studies highlight the individual experiences and preferences that can influence the choice between Xarelto and Warfarin. Consultation with a healthcare provider, making an informed decision. When it comes to choosing between Xarelto and Warfarin for thrombosis prevention, it is crucial to consult with a healthcare provider. They will consider your medical history, risk factors, and personal preferences to determine the most suitable option. During the consultation, your healthcare provider will discuss the benefits and risks of each medication, taking into account factors such as effectiveness, side effects, convenience, and monitoring requirements. They will also address any concerns or questions you may have, ensuring that you have a clear understanding of the treatment plan. Conclusion and final thoughts. In the duel between Xarelto and Warfarin for thrombosis prevention, there is no clear winner. Each medication has its own set of advantages and disadvantages, and the choice ultimately depends on the individual's specific needs and preferences. Xarelto offers the convenience of fixed dose administration and no regular monitoring, but it carries a higher risk of uncontrollable bleeding. Warfarin, on the other hand, requires regular monitoring but has a long track record of success and is more affordable. When considering Xarelto or Warfarin, it is essential to consult with a healthcare provider who can assess your unique circumstances and guide you towards the most appropriate treatment option. Understanding the benefits and risks of each medication and weighing them against your individual needs will help you make an informed decision in the quest for the best thrombosis prevention strategy.